Dr. Salim Surani joins us once again to answer your COVID-19 questions. But before we begin, we want to give a quick little bio on why we've chosen Dr. Surani to help us better understand what it is that we're dealing with. The doctor is currently the chair of critical care services at Corpus Christi Medical Center. He holds several master's degrees, including public health and epidemiology. He has been instrumental in starting emergency medicine residency programs, as well as pharmacy residencies and pulmonology and critical care residencies. He's published worldwide, having authored more than 250 articles, and has written several books, as well as chapters for other medical books. On top of that, he's responsible for training a majority of other physicians in our South Texas region, including primary care, internal medicine, and emergency physicians. Finally, his areas of expertise include critical care, sleep medicine, ICU infections, and practice operations. So, with that, Dr. Salim Surani joins us this morning. Sir, it's great having you back on. Hope you had a good weekend. Let's get right to it. I'd like to ask you why we're seeing a sudden spike in meat packing plants and poultry processing plants, and this is across the United States, not just here at South Texas beef plant.
Good morning, John Thomas, and all the viewers. I think this is concerning and not surprising. As we talked about in the past, that the challenge when you don't have a herd immunity, or when you have a very densely area populated, or you have a vulnerable population like nursing home or senior citizen home, if you get one case over there, then the chance of it spreading it and in a very close environment is very, very fast. And we had initially a couple of cases in the beef plant, and now the number is increasing. That's becoming a more concern. And I think, again, it boils down to the very rapid testing and trying to isolate, contain, and mitigate those areas. I think the more testing they're going to do, when you have more than two, then we know that the R0 is more than 2. So it is bound to see that we may start seeing more and more patients who may be positive over there. So I think that is a very concerning. Now, the thing is that it means that you have to be looking at very closely. Once the number goes above 10, then it becomes an issue. And if you keep on having a higher number, then the question would be is that what we need to do, how we can isolate and mitigate. It means that pretty much everyone over there needs to be tested, and whoever is positive, they need to be isolated, and whoever is in close contact, they also need to be considered quarantined. And if for some reason they are very asymptomatic and they're negative, then they need to be very closely watched. And also, I think one need to place a very special emphasis on decontaminating the area, and also like hard surfaces, they need to make sure that they take an extra care and vigilance. The same thing what we expected in one of the nursing homes, like one of the healthcare provider or a patient with the COVID goes in, and that becomes a possibility if they're a silent carrier, they can keep on passing it to the other one. This becomes more concerning and challenging in an area where the herd immunity is low, where our community transmission is low. So when you see the cluster, that's where the public health comes in, where you go in, isolate quickly, and try to prevent infection and mitigate the area very fast.
Well, that leads to another point, because up in Austin, medical experts are saying that they're seeing another surge, or not another, but seeing a surge in construction workers there. We know there's a lot of construction going on here in South Texas. So what's behind that finding?
The main thing is if the construction workers are working in a very close areas and physical distancing are not there, that can be a challenging. The second thing is that a lot of the construction equipments are kind of a steel and those hard surfaces area where the virus can be there for longer. And we know that a lot of the construction area, we don't decontaminate and clean as often as we do it at our home or offices. So that's a challenge. The second thing is that the construction workers are not immune from not wearing the mask. So, when you go around and see the construction going on, we see a lot of folks actually not wearing the mask. So I think the public health measure applies to everyone. And I think if we follow the public health measure, if we take care of each other, even the cloth and mask are good, so that we can protect each other, we can decrease the transmission of the viruses. Keep washing your hand, keep the safe distance, cover your face with a cloth mask, I think you will do fine. But if you don't follow the rules, the challenges occurs.
Okay, Dr. Surani, that's great advice right there. We're so grateful to have you throughout the morning, and we're already getting the questions pouring in. So if you do have a question for Dr. Surani, send us a text at 361-855-6397. We'll be sure to get to those as we go through First Edition this morning. And again, Dr. Surani, thank you so very much. Children